Welcome, everyone. I'm Dick Deming. I'm Medical Director of Mercy One Cancer Center and the founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. It's brought to you in part by a grant from the Iowa Oncology Society. And our guest this evening is Dr. Mark Vander Weg. Welcome, Mark. Dr. Vander Weg is clinical psychologist, and he is the professor and head of the Department of Community and Behavioral Health at the University of Iowa. Welcome, Mark.
Thank you so much. I'm so happy to be here. Appreciate it.
Well, great to have you here. We're going to be talking about behavior change as it can be used in helping to reduce the risk of cancer and other healthy endeavors. But before we do that, we're going to get to know you a little bit, Mark.
Great.
So I already said you're a clinical psychologist, but tell us a little bit about yourself. Where did you grow up?
So I grew up in Michigan, a small town in Michigan, rural town in south central Michigan called Marshall. And that's where I was born and raised until went off to college in Holland, Michigan, in a small liberal arts college called Hope College.
And high school, how big was your high school? How many in your high school graduating class?
Yeah, our high school graduating class is I think 227, something like that.
Okay.
So pretty small, but certainly there are smaller.
And what was your personal claim to fame in high school?
Oh, my personal claim to fame. That's a great one. So, I guess I was known a bit as being a rather active Elvis fan, and brought Elvis dances to the high school, the local high school. In particular, affinity for the Clam was the name of the dance. I can't believe I'm talking about that publicly, but it was just a lot of fun.
And then you went on to college at Holland, Hope College. And what was when you started college, your very first declared major?
So my very first declared major, in it turns out I saw it through that way, which is kind of rare. I think about it in retrospect, and especially as I think about sort of how my career got me here. But it was psychology. That was I went in knowing and thinking at least that's what I wanted to study. It was great being in. I'm at the University of Iowa, public institution. As an undergraduate, it was liberal arts. I loved the liberal arts environment. You get exposed to so many different things. But psychology has always fascinated me, so I stayed, consistent with that. My path afterwards went in, kind of different places, but that was consistent from the start.
And so once you got your 4-year bachelor's degree, did you go out into the workforce or did you go right on to graduate school?
I went right on to graduate school, and if I could do it over, I might do it differently. I think having some of those experiences can be really helpful.
And your graduate degree, did you do it separately, a master's and a PhD, or was it one big program? Or
It was one swoop, so it was all in the same. So I got the master's along the way. Yeah, to getting the PhD. And so, when I finished, I had, I think, great educational background, but maybe not a whole lot of applied experience at that point. Just kind of went right through, which is, it worked for me, but I do think there's some nice advantages of kind of getting out and seeing the world
yeah.
a little bit.
So, medical school, you just kind of show up and they give you all the classes. You don't really make many decisions till you're done with medical school and then specialize. As you were working your way through your PhD, how did you decide on what particular aspect of psychology to focus on for your PhD?
Yeah, so thanks for asking. So I had, since the beginning, had been interested in clinical. I thought I would be a clinical psychologist, a practicing psychologist. Just was drawn to that, was fascinated to that. But what I hadn't anticipated is as an undergraduate, I got in a health psychology course, which I was just fascinated with the intersection of psychology and our health, and how those things are so strongly interrelated. And I had a great experience as an undergraduate and sort of felt like that was the area I wanted to kind of move into. And so when I did my graduate work, we had a subspecialty program in what was called behavioral medicine. So that intersection between our behavior and how that can affect our health and our well-being. And that just felt like the place to me that just felt um, endlessly fascinated by it, but it just kind of felt right to me. So I gravitated towards that.
Yeah, and behavior is so important. So let's just shift a little bit to cancer. So
Sure.
we've been talking a lot about cancer in Iowa because we have such a high incidence of cancer. We know from many, many studies that about 42% of all cancers in the United States could be avoided with behavioral changes, and about 45% of deaths. So even if we didn't do anything more in terms of creating a new test to find cancer or a new drug to cure cancer, if we just did the things we know, we could almost 50% reduction in deaths. But a lot of it requires behavior changes. So
Yes.
when you look at the modifiable risk factors that include cigarette smoking, how we eat, obesity, whether we engage in physical activity, whether we consume alcohol, whether we put sunscreen on. I mean, all of those have a component of behavior and behavior modification. I've chatted with people at the American Cancer Society. It's almost like we need to focus, like cancer control organizations need to get more experience and expertise in helping people modify their behavior.
Yes. I couldn't agree more. It's absolutely the case. There's the linkage is so strong, but we haven't prioritized that. We haven't made that a significant focus. Now, I say that to use you're sitting in a fitness room, doing, physical activity. So clearly, there are places where this is happening, in a wonderful way where it's being embraced. But by and large, it hasn't necessarily been as big a part of the story or of our focus as I think it might be. Now, I may be a bit biased because it's what I do, but I couldn't agree more.
Yeah, and obviously, centuries ago, getting physical activity was not a problem for most people. It was a necessity, and also we didn't have quite as many, Oreos and Twinkies just hanging around in the break room for everybody to eat. So it was, I don't know if it was easier. I guess cigarette smoking, we made some big, back when I was born in 1953, about almost 69% of adult males smoked, and so we've made progress in behavior modification there, but it's not been by accident. It's because
Right.
of public health policy that was adopted to specifically alter behavior. Mostly it was making it too expensive to smoke
Yes.
that allowed us to do that. This whole thing with sugar and Twinkies and cakes and cookies, and that's a little bit harder to, whether or not taxing our way to healthy eating is a way to go. Well, how do you look at just the big picture of behavior modification as a psychologist? What do you think of as the core tenets to programs that alter people's actions that they have control over?
Yeah, so I appreciate that question. So I'm going to start with what may be um, a surprise answer. It may seem a little bit circuitous, but I hope I'll get where we're intending to go with this. But you mentioned something I think is so important, which is the policy piece. The policies are really central to the success of our efforts. Now, by training, I'm a psychologist. My training is the one-on-one with people and helping them, whether it be to address difficulties in their lives or to, embark on some sort of behavior change of some sort. And those two things to me are very much interrelated. But one of the things I recognized early on is that even though we have quite effective behavior change programs, and I'll get back to what some of those consist of in a moment. It really is the policy, the things that have made the greatest difference. And so I would love, I would love for sort of my profession and subdiscipline to be able to make, a good claim on the progress that we've made. But it's really policy. It's those kinds of things, and at the heart of it, it is sort of making the healthy choice the easier choice. And that may be coming from, where it is more expensive, and that can be controversial. One of the most effective strategies that we have is taxation. And that doesn't have its limitations, and we need to be thoughtful about how we do that. but it does work. Those kinds of things work very well. These smoking restrictions, things like that, are quite effective. And you and I can remember where it very much wasn't, the way that we have things restricted the way it is now, where, tobacco use was, you know, and I'm focusing on that because it's what I do more than anything else, but it was so prominent. And those policies that have helped to, more than anything else, protect people from some of the harms of that tobacco smoke, those kinds of things have been particularly effective. Providing access to treatment and access to effective strategies. Um, those are things that haven't always been open to everybody. Those are things that if you have the resources or have access to, you can avail yourselves of. But we've done better about those things. Um, and so those are things that I think have helped to make such a big difference in this particular area. Now, whether or not those translate to other kinds of behaviors is an interesting one that I think we're looking into. We're trying out. We're testing. There have been efforts to do things such as the sugar taxes and making certain kinds of sugar sweetened beverages. Limits on sizes of those kinds of things, and outlawing certain additives in foods. And I think there's a case to be made for that, and I think there is a precedent with tobacco that we can see and we can learn from. But it is also, not without its limitations. Folks often, generally speaking, we don't like to be told what we can and can't do. We like to have those choices for ourselves, and so I think that we have to be aware of those things. We have to be aware that if we are taxing, and this goes to tobacco as well, are those who bear a disproportionate burden of the health issue also getting a disproportionate burden of the taxes. So, not everybody smokes at equal rates. There are certain segments of the population that, for various reasons, may be more likely to smoke. And so we want to be wary of, if we have policies, are they going to be impacted more or less than others? So that's just my way of starting with, saying, even though more than anything else, I work with people sort of one-on-one in small groups. I think the policies are the things that can make a big difference. But then to think about what we can do as individuals. And so I think there are a few things that are pretty consistent across. I think one of them has to do with learning about our behavior as much as we can. And that applies to whether it's tobacco, whether it's eating foods that might not be healthy for us. It may be with sedentary behavior, or with any of those kinds of practices. We want to understand our behavior. And so the psychologist in me frequently will ask folks to do what we call self-monitor. So if you want to find out about your patterns of smoking or of eating certain things, keep track of it. Keep, a nice detailed diary. We've got some shortcuts to make it easier, but finding out, when are you engaging in that behavior? When is it more likely to occur? What are the patterns throughout the day? Are there things that are going on when you're more or less likely to do that behavior? And those can be things that are positive behaviors or potentially harmful behaviors. So are they linked to your mood? Are they linked to your time of day? Are they linked to, what else is going on at that particular time? So learn as much as you can. And that's a good starting point. And then also setting goals. And it seems kind of basic, but it really does matter to have a very specific goal in mind. Oftentimes, I'll work with people who have a sort of non-specific goal. And oftentimes it's a matter of, I want to eat better, or I want to cut back on, the amount of this I'm engaging in or that. So I want to cut down on my smoking, for example, or I want to eat less of this or exercise more, all of which are great goals. Those are great things to start with. But the specificity matters, to be able to say, this is specifically what I'm looking to do. And, both in the short term, have nice short-term goals that we can achieve, but also longer-term goals. Learn along the way as you're going through this. I work with so many people who have had struggles along the way. We all have. I've struggled with health behavior change my whole life. We all do. Um, and the key is to kind of keep going, keep persistent in that. So we all will struggle. And the thing that's most important is to learn from that so that when it comes up again, what can we do different? And along the lines of that, sorry for the psychologist speak, but we talk a lot about what we call the abstinence violation effect. So if you are, for example, changing your diet and something happens and maybe somebody comes by with a dessert or offers you a dessert or something you hadn't planned on eating. There's a tendency that when we, indulge in that, and it happens to all of us, then there's a tendency to sort of think, well, that's it. I've failed. It's over, and all that good work I've done is for naught. I've had that cigarette, and now I'm smoking again. And so we want to look out for those, that sort of all or nothing thinking. How can we, you know, understand and be kind to ourselves as we experience these things, learn from it, but also put it in context. If I've had that extra cookie I didn't plan to have, or I had a cigarette when it was really, really stressful and I wasn't prepared for it, it's a cookie, it's a cigarette. It's not, we don't have to give up what we've done. So those are things that I think are helpful. Some other things that folks often resist, and I understand this, but it does help, which is having some sort of public commitment. And it doesn't have to be a big thing. It doesn't have to be on Facebook, but letting those close to you know, look, I'm going to try to make this change. I'm going to try to make sure that I'm being more physically active. And so I'm going to start walking 15 minutes a day after dinner, at least 5 days a week, or whatever that is. Or I'm going to commit to myself that I'm going to quit smoking, and I'm going to do that starting on Thursday. And I want you to know it so that it would be helpful for me if you could support me, if you could understand that maybe for a while it's going to be hard, but stay with me. But also, help me be accountable. And it's something that oftentimes we resist because we don't want to not succeed, and we don't want people to know that, but it does help to do that. And then finally, I know I've been talking for a long time here, but another thing that can be really helpful is to have plans for what do we do when things are going to get challenging, because they always will. And whether that is a matter of, maintaining physical activity, maybe when we're traveling, or how do I stay active when it's busy season at work, or I'm having a really difficult time right now with my stepson. How do I, manage, the challenges I'm experiencing without resorting to cigarettes or having alcohol, those kinds of things. And so knowing up front, what are the challenges? What are things that we can do in advance to set it up so we'll be less likely to engage in the behaviors that we're trying to avoid? So those are things that are helpful, and I didn't intend it this way, but that sort of goes full circle to where I started, which is understanding our behavior from the beginning. So if we know the patterns, we know the things that are the cues, the triggers, the times when we're more likely to do the things that we're trying not to do, or that we're trying to do, and then we can plan accordingly. So those are some things that, regardless of whether I'm working with folks on weight loss, on physical activity, tobacco use, those are consistent things that come up, or that we try to focus on.
I would say that most people, as they try to change their behavior, don't have ready access to someone like you to be a one-on-one, highly educated, trained person to help them. So they sort of muddle through with their friends or with just, self-help as they go through. What would you say, is what you mentioned seems so practical. It doesn't sound like you're going to hypnotize them and make them, have no craving for alcohol or tobacco or Twinkies. That it's more just the basic understanding what you're doing and using then self-control.
Yes.
What is it that you provide that helps them have more self-control? Is it just understanding their own behavior? Is that primarily the secret sauce of a psychologist, as opposed to something, as I mentioned, like hypnosis or something that we think of as magical?
Yep, I think it is. I think it is having someone, first of all, someone who is hopefully, if you're working with someone that's going to be non-judgmental, that's going to be understanding, that's going to be supportive of you in your journey. I think that matters a lot. And also, um, someone that you're going to talk to today, or you're going to talk to sometime this week, who I'm planning for that conversation, and I know that they're going to want to know. So I have to sort of, there's a certain amount of accountability that we all can benefit from. I think those things are helpful. When I started this, I would say, sort of committed to finding the thing, the kinds of strategies. What are the specific psychological techniques that are going to have that are going to make all of the difference? And it's not that I don't think the things we do matter in terms of the strategies. We do certain kinds of cognitive behavioral therapies and behavioral therapies, those kinds of things, those matter a lot. But I think it a lot of it has to do with the relationship that's building, and helping folks to have a plan, have some strategy for doing it. So often when we make change or we attempt change, we haven't really planned for it. We just sort of, whether it's the inspiration striking us at the moment, or whether it is, something's happened that's made me question. And then we start to change without really thinking about how to do that. And, for some folks, that's all it takes. For some folks, just making that decision and it works just fine. For most of us, it takes a little bit more. It takes a little bit more trial and error and learning. And those are the things that I think make a big difference. I wish it were as simple as hypnosis, and some people have benefited from that. But for the most part, there are other strategies, and as you said, practical ones. And more of what I do as a researcher involves having others, whether it be graduate students or other health interventionists, working with folks who are trying to change. And I've had the sort of insight that it's less and less about the protocols, I think, that I design and write for folks to work. I'd like to think, boy, that's what makes all the difference. I don't think it is. I think it's some of these practical strategies, and having someone that can be with you and guide you along this journey. And that's actually really good news, because that one doesn't need a clinical psychologist for this. One doesn't need, although sometimes that can be helpful too, but there are others who can help you along the way. And so, not everybody, may have someone with that background, but many of us have someone who we can talk to and can help implement these things.
It seems to me that most of these things, that behavior modification that can prevent cancer, most people probably don't do it specifically to prevent cancer, but generally do it to feel better.
Yes.
That even if you stop smoking but happen to get cancer, which can happen,
Yep.
you still benefit by an improved quality of life, by not smoking, by eating healthy, by engaging in physical activity, by limiting alcohol intake. All of those things, the reward may be better life, even if you happen to get hit by a truck or you develop cancer, even though you stop doing those cancer risky behaviors.
I think that's absolutely right. And as you're talking, it sort of occurs to me how, I think sometimes some of our messaging isn't in line with what you've just said, because I agree with you 100%. And most of the time when we are talking with folks, it's about avoiding the bad, or oftentimes it is, here's why you should do X, Y, and Z. Um, And those things may be true in terms of, the harms that can be avoided. But what we perhaps don't emphasize enough, and what the things that I think oftentimes people are searching for, is the benefit. So physical activity being a great example, how wonderful that can help make us feel. That I think probably drives us more in terms of both initiating that behavior and maintaining it over time, is those positives. And we don't necessarily emphasize that enough. And it's interesting with tobacco that what I hear so often, probably 90-some% of the people I work with will tell me that it's a reliable stress reliever. Things are tough in my life. When I get stressed, this is the thing I can turn to, and reliably it helps. And there's certainly, I can't argue with the short-term mood management, the things that folks get from this. Ironically, a lot of that is because it's withdrawal that we go into throughout the course of a day, so that having the cigarette helps to minimize that withdrawal. But it's also the case that we have, because in the short term, folks can experience, some sadness, some irritability, those kinds of things. There's a tendency to think about this as both leading to us feeling worse or a loss of pleasure. But reliably, what we find is people who quit smoking, and the same would apply to alcohol, the same would apply to making, increases in activity and diet, do feel better. So it's not that you're going to feel worse by not having that thing, that ability to manage mood, but both in ways small in terms of day-to-day mood, but also in terms of more significant psychological distress. It gets better. So I do think those are the kinds of things that that we can be promoting, and probably should more. We tend to sorry for more psychology speak, but we tend to be delay discounters. We have a short-term sort of perspective, which is, what's immediately in front of me matters more than what might happen tomorrow, or a week from now, or 2 years from now. So when faced with that decision about consuming a very palatable, good tasting food, or when thinking about, what is it going to take for me to get up in the morning to do the activity, or how hard it will be to quit, we tend to, put much more emphasis on what's going to happen to me in the short term. What I think we haven't done as well about is promoting that in the short term, these changes can bring about really positive things for us. So, and I think physical activity is maybe the great example of that to me, in terms of what that can do for us. And it doesn't take months, it doesn't take years, it's something that that we can benefit from it right away. So I'm sorry for taking off on a little bit of a tangent there.
No, that's great. Let's talk a bit more about public policy, because we both mentioned that as an important thing. That so cigarette smoking, we went from over 50% of the adult population smoking in the 1950s to now down around 15%. And that didn't happen just because we told people you're going to get cancer if you smoke, and everybody decided, oh, okay, I'll stop smoking. It was because of big public policy,
Yes.
including, as we've already mentioned, the tax on a pack of cigarettes, also making it inconvenient or impossible to smoke in certain situations. And what would you say are some of the other sort of landmark public policy interventions that the United States did, and or other countries? I mean, I was just in Nepal, where every pack of cigarettes has these ugly pictures of
Yes.
people with cancer and deformity, and so you can't help but be reminded of the negative. What would you say in terms of public health policy related to tobacco that are noteworthy for us to remind ourselves of over the past 50 years? And then we're gonna go on to some of the other behaviors, and maybe come up with either some analogous policies that might help.
Yeah, so thanks for the question. So, 1964 was landmark, and it wasn't a policy, but it was the first time that the Surgeon General report came out talking about the health risks of smoking. And that was a significant thing to have a leading government authority to come out and indicate the significant risks associated with smoking, and that did make a difference. That got people, starting to question it and recognize the potential risks associated with it. We've had a number of other things that have come along the way as well. So some of them we've talked about tax changes, so I won't mention that so much. One has to do with the availability and the visualizing of these behaviors. So when it comes to tobacco, used to be advertised freely on TV and on the radio. You could see it in all kinds of places. Ironically, the leading advertiser for Flintstones cartoon was Winston cigarettes, and so you'd have an advertisement, accompanying the TV. And so there was in the very early 70s a law that was a sort of a fairness doctrine that was enacted, which was for every cigarette ad that was out there, it was a pretty brilliant policy strategy, which was it's a controversial thing to be advertising that. We need to give equal air to the other policy, to the other side. And so that made it possible for public health campaigns to run anti-tobacco ads. Because otherwise we don't have the pockets, we don't have the money that big tobacco does. So there were a large number of anti-tobacco ads that were running on TV. The irony of all this was that big tobacco decided and came forth and said, what we're going to do now is we're going to voluntarily stop advertising our products on TV and on the radio, which we declared as a public health victory. But what it really was so that there wouldn't be the airing of the anti-tobacco ads. So that was sort of a plus and minus that came there. The changes that we have seen, or rather not seen, in the warnings that you mentioned. So, putting the warnings on the cigarette packs was initially a very important step that mattered a great deal. What has happened is that they have not changed in the United States in decades and decades, and people no longer attend to them. But those ads that you're talking about, or those warnings, the graphic warnings that we're seeing all over the world, those have had a dramatic effect. Those have made a difference. We can see rates of tobacco use going down in in parallel with those. The United States, we haven't been able to enforce that for a variety of legal challenges. It's been something that we've been promoting for a long time, but it hasn't moved forward for legal reasons. But those kinds of strategies matter. We came out in the early 2000s. A big policy thing that made a difference was the establishment of a nationwide tobacco quit line. So no matter where you are in the United States, if you dial 1-800-QUIT-NOW, you will get sent to your state's tobacco quit line, where you can get free treatment that typically, it varies from state to state, but typically includes counseling. Oftentimes there's text messaging kinds of treatments, depending on the state, depending on budgets, can also be pharmacotherapy, but really, really effective treatments that people suddenly have access to. There are no economic barriers to it. It doesn't matter where you're living, you have the same access. And that has been, tremendous for improving access to treatment. Our state tobacco quit line does a wonderful job. And I'll mention one other thing that hadn't talked about yet, but that is, I believe, coming, and I do believe will be a game changer, which is for 30 years, we've been trying to get a mandate for the maximum amount of nicotine that is in a cigarette, and to try to regulate it so that it's below the level of dependence. And this has been something that started in 1994 to try to make this happen. It took a act of Congress for the Family Tobacco Prevention and Control Act of 2009 for FDA to have legal authority. And it's been a work in progress ever since. But I think this is going to happen where we are going to see mandated thresholds for how much tobacco is in a cigarette that will make a significant difference on whether or not somebody can become dependent on cigarettes.
And you mentioned the amount of tobacco in the cigarette or the amount of nicotine, or it's both. Is it related to specifically nicotine or to just the grams of tobacco that's in a cigarette?
It's a great question. So it is the nicotine itself. So how much nicotine can be extracted? And we have folks may remember low nicotine cigarettes, low tar cigarettes that were out there for years. This is entirely different than that. So those were not, they were not in any reduced harm. And the truth is that was a strategy that was used to make those seem less harmful. But the way that folks would smoke them, basically they got lower tar and nicotine yields because there were vents in the filter. And when those cigarettes were tested in the machines by the Federal Trade Commission, the smoke was vented. It seemed like there were lower levels of nicotine and tar. When actually smoked, people put their fingers unknowingly over the vents or their lips over the vents. And folks tend to adjust their smoking to get a certain level of nicotine. So if they're accustomed to more nicotine, they will smoke more heavily. They'll take more puffs. They'll draw more deeply. So those were not, they were effective for what the tobacco companies wished to do, which was to make them seem less harmful. But what they didn't do was reduce nicotine or tar. This new policy that's being discussed and debated and that the FDA has said they're going to pursue would make it, would limit the amount of nicotine that was available in the cigarette to a low level. So no matter how hard one smokes it, no matter what they do on the ventilation holes, will not matter. It won't be possible to extract much nicotine from that. And so that's something that I think can make a big difference.
Yeah. So my understanding is, I mean, the nicotine doesn't cause the cancer, it's the smoke, but the nicotine leads to the addiction. So the hope with this strategy is people would be less addicted and maybe make it easier to stop the actual cancer causing thing, which is just inhaling smoke.
That's absolutely right. Yes. And so that would make it much easier to do that, to quit. And also for youth who start, usually they tend to start for reasons other than the nicotine. It tends to be, whether it is a fitting in sort of thing, whether it is social. But they eventually, as they become dependent, smoke for the nicotine. That is the thing that we become dependent on. And you're absolutely right. That is, nicotine is not completely without some cardiovascular risk and other risks, of course. But when it comes to cancer, it is the tar, it is the other constituents. And importantly, and I don't mean to get too far into the weeds with this, but one of the concerns we've had is that, well, if we lower the nicotine, will people just smoke more? But there's been a lot of studies that have been done to show that that does not happen, because the fear was, yeah, we'd reduce the nicotine, but people would smoke more and then be exposed more to the smoke and to the tar and that sort of thing. And that doesn't appear to be the case.
Let's talk a little bit about some of the alternate nicotine products. So there's obviously a lot of them. There's vaping, but there's also other ways of getting nicotine from pouches that you might put in your mouth. Obviously, there's patches and gum, some of which have gone through FDA approval as smoking cessation devices. There's a tendency now for the tobacco companies to want to make up for the fact that, we've gone from over 50% smokers in adults down to 15%. They are a business. They need to sell things to make profits. And so there's other ways of getting nicotine into individuals that become addicted then and need to continue to purchase nicotine products. One of the fears is that you get the non-combustibles that the young folks get started on. they get addicted to nicotine, they may turn to the combustible products. But there's also this argument of harm reduction.
Yes.
Maybe doing nicotine and non-combustible, and you're still hooked on nicotine, but you're not getting cancer as a result of it. What is the research? What does it show about young people starting off with nicotine that isn't combustible? Do they go on to cigarette smoking? What's the data tell us?
Yeah, so the data are, and I wish this wasn't what I'm about to say, but they are a little bit inconsistent in that regard.
Mm.
So we certainly do see some folks who start out with some of these products, with vaping or other products, who then sort of graduate, as it were, to a different product. I don't believe that's happening as much. Well, I'll just speak for myself. It's not happening at the level I worried about when these came out. It's happening. It's a level of concern. But it's not as frequent as I worried that it might be. Now, there's reason for concern with these products. They do cause dependence. They're not without risks. When it comes to vaping, there are other chemicals that are in those that people can consume that are carcinogens but at much lower levels than what we see in combustible cigarettes. And so there's not a real easy story here. And so I think what we have to do is we have to be open with folks about this. Combustible tobacco products, cigarettes, cigars, pipes, those things, without question, the highest risk when it comes to cancer, when it comes to cardiovascular disease. The oral tobacco products, moist snuff, chewing tobacco also have significant oral pharyngeal cancer risks, no question. Below that would likely be, and we're still learning, but below that would be probably the vaping devices most likely. And then we have these new products you mentioned, which are, the pouches, which are made up of most of them are not tobacco at all, but a synthetic nicotine or a nicotine analog. And because of that, they're in sort of a regulatory gray area.
Right, they're even advertised as tobacco-free products.
Yes.
So they're not even considered tobacco. They're synthetic nicotine.
That's right. And some of them, there's one I've seen that even advertises itself as nicotine-free, but that's a difference, a distinction that doesn't matter because it has the same physiological effects of nicotine. It's just that it is an analog as opposed to nicotine itself.
Well, let me ask you this, because there must be a positive something that happens when you do nicotine. I've never, both my parents are smokers, both my parents died of smoking, never had any interest in doing it. But it would seem, as someone who has had an alcoholic drink, I know what it does.
Yeah.
And one can attribute that feeling as something positive. There must be something that people attribute as a positive effect of putting a nicotine patch in your mouth.
Yes. So it does have a stimulation effect. So as a psychostimulant, so it gives, it increases alertness. It can facilitate some of our thinking, but it also gives a little bit of a rush that, that happens with it. Now that rush doesn't come initially. Most folks find nicotine quite aversive the first time or two or four that they have it, but eventually there is that sort of stimulation effect that folks, feel, that helps to drive that behavior, a little bit of a mood enhancement. And there is a flip side to that too, that I mentioned earlier, is that some of that is real. Some of that also is a perception that when it comes to nicotine, if we're not using it, we start to go into withdrawal very quickly. And so we start to feel sluggish. The mood starts to wane a little bit, get a little bit irritable. And so if we take nicotine, that tends to go away. It's what we call negative reinforcement. So it feels like your nicotine's picking you up, but what it really is sort of feeding into that dependence. But it is, the psychostimulating part of it is a big part of why people sort of the positive that they get.
Um, I do want to leave time for questions, but let's just talk a little bit about alcohol.
Yeah.
Alcohol, we've known for a long time that alcohol increases the risk of cancer, but the public didn't know about it quite as much. I think a recent study with the Surgeon General's report a few years ago, it was Murthy, and that virtually 100% of people knew that cigarette smoking was
Yes.
related to cancer. Maybe it was 90, whatever, but only about 40% of the individuals, the general public, knew that there was a relationship between alcohol consumption and cancer. And so that has led to more emphasis on that particular information and education and advocacy.
Yeah.
We have seen in the United States a decline in alcohol consumption. I don't think it's because the Surgeon General came out with a report 4 years ago. What do you see as uh, the cause, or the factors that have resulted in less alcohol consumption? And what do we know from the tobacco story that might influence how we address public policy related to alcohol?
Yeah, those are great questions. So I think we're still learning why we're seeing that decrease, at population level. It's a welcome thing that we hadn't necessarily um, anticipated, but it seems real. This is not doesn't seem to be an artifact or something that is a particular one study have found. It seems consistent, and it seems to be a lot of this seems to be driven by younger populations, younger folks who historically, in my generation, other generations, have been a group that have been more actively engaged in drinking at that age, are foregoing alcohol. And there seems to be a greater, they're not telling, or at least when I talk to folks, they're not saying, well, I've heard it's because of cancer, but there is more of a focus about well-being and about, trying to take better care of themselves and about sort of embracing wellness in a way that I don't recall being as prevalent as, in my generation growing up. So it appears that that is a big part of it, that sense that this is contrary to the goals that I have, which is I want to feel good. And this gets in the way of that. But we're still learning. That's largely speculative, to be honest. But I think that's a pretty consistent take that people have. And that's a great thing. And I hope that that continues. Um, with regard to sort of things that we can learn, I think from a health and public health perspective, we have for so long when it comes to alcohol, we have focused on what we would call problematic use. Is somebody drinking alcohol in such a way that it's causing problems in their lives? And when we bring it up at all, it's usually in that context. And so
Mhm.
it's only, it really only gets discussed if somebody thinks there is a problem. And so to bring it up is to sort of imply there's something there, that your drinking is somehow causing problems. And I think that's sort of the culture around, talking about reducing alcohol. It's certainly the culture around healthcare. So I do a lot of work with primary care, with folks who try to encourage recommending and supporting health behavior change in their patients. Started that with tobacco, but also work with alcohol. And there is a hesitancy to bring this up. We've sort of framed alcohol discussions as being about addiction as opposed to health promotion. And
Mhm.
when it comes to alcohol, what we hadn't, I think, anticipated is that for some types of cancer, that risk starts at pretty low levels. So just about any level of consumption of alcohol increases our risk for breast cancer and increases risk for colorectal cancer. And so it's not just when someone is drinking to excess, it's when we're
Mhm.
having any alcohol. And so I think we have to sort of, think about how we're having those conversations. It is, I hear a lot of providers who are reluctant to bring it up because of how it will be received. Talk with patients who, when it is brought up, who have said, I don't understand why you're talking to me about this. Do you think I have a problem? So I think we have to sort of talk, to readdress how we're talking about this in various contexts. and to normalize it and make it a regular thing for us to discuss. With regard to tobacco, some things I think we can learn. I think some of the policy strategies are similar. The pricing strategies, and increasing excise taxes, those things work. And when it comes to alcohol, it has actually gotten more affordable over time because it hasn't kept up with inflation. And so it is a very affordable thing in the state of Iowa. Limiting the number of places that one can access alcohol has been found to be very, effective. So, limiting the number of licenses and retailers and availability, limiting, drink special kinds of things that we can do. Those things can be helpful. And I also think that, that one of the better strategies that we have is the relationship between healthcare providers and their patients, and having these conversations. When I started, it wasn't something that was talked about a lot in healthcare, other than sort of, you need to stop smoking, it's bad for your health. That was kind of the discussions that were happening in most medical settings, to now where folks are getting brief counseling advice, connection to quit line medications, those kinds of things. There is so much more that we can do in healthcare and in dental care and things like that, than if we just refer folks to specialists, to go in for care. So having those conversations as part of routine discussions in healthcare, that can make a big difference. And we're not doing that. It's a hard conversation. But I think if we're doing that, those are conversations that can be uncomfortable at times, but folks want to talk with healthcare providers as opposed to usually, talking to strangers. So those are things that we can do.
Okay. Well, we're going to open up for questions. So the general topic here is behavior modification, and we've got a live studio audience. Those in the room, you get first questions. If you are watching us live streaming right now, you can put your question into the comments section or the chat section of the software you're using to watch us. So let's start off. Kevin, you go first.
Do you think the reduction in the alcohol use is related to the availability of alternatives? You can go out and buy a monster drink full of caffeine, or you can buy a gummy, or there's all kinds of other things instead of alcohol.
No, you're absolutely right. So the availability of alternatives makes a very big difference. And not all the alternatives, some of them that you mentioned, are necessarily going to be healthy. But having less risky, healthier alternatives around, and having those enriched in the environment can make a big difference. We talked a little bit about what we're seeing, with younger people, not necessarily using alcohol as much, but what we also are seeing, the flip side to that, is a proliferation of so-called mocktails and non-alcoholic alternatives that were not that popular even a short time ago. So the alternatives matter, but you're absolutely right. And sometimes those alternatives may be worse, and sometimes they may be healthier. And of course, we want to enrich it with healthier alternatives.
Next, George.
I'm interested in the psychology of young people, which I know you're focusing on so much because they are the future, and it has to do with this cancer rate and everything. Used to be young people maybe weren't so concerned about the future because there were wars. I mean, I might die next week in a war, so I'm going to do drugs and alcohol and tobacco and that type of thing, and who cares?
Yeah.
Now, conversely, young people, they don't have the wars to contend with, but the polling tells us a lot of young people don't expect to retire. A lot of them don't expect to live to retirement. So how do these psychological factors of young people play into what we're seeing with cancer rates?
Yeah, no, that's a great observations. And I wish I had a really good answer for it, other than to say that I completely agree. The social circumstances and what's going on in the world make a big difference. And there was for generations, there was, a sense of it doesn't matter what the long-term health risks are, because I'm not going to see it anyway. And that definitely impacts, one's desire to use or not use certain substances. I worry a lot about things today as well, and I don't know. It's interesting because we are seeing these tendencies among youth to, to drink a little bit less. They are using other substances like cannabis at a higher rate, but a lot of that has to do with availability and legal, the fact that it's legal and so forth. But I worry a lot about the world that folks are entering into right now. The sense of, I'm not going to be able to retire because it won't be economically viable. The things that are going on around the world that we are much more acutely aware of now than what we ever were in my generation, because we just didn't know. Maybe we'd read about it in the paper, but it wasn't in our face all the time. I think we have to be very thoughtful about addressing, and I wish I knew the answer to this on a social level. But I think we have to be thoughtful about those things. Those things are going to matter. Those things will impact our day-to-day behavior and decision making, and the extent to which we don't see a bright future for ourselves or have a hard time imagining that certainly contributes to a lot of significant psychological distress. And all of the behaviors we're talking about are linked to to our mood and our outlook around life. The good thing is that some of these behaviors, like physical activity, they help, with mood. Those are things that, do help to manage, and it's positive. Some of these other substances are things that we use to cope with that sense of futility. And I'm sorry, I didn't, what I really have to say is I just really appreciate the observations, and it's something we need to be thinking about. It will be hard to invest in personal behavior change when this is the world that we're seeing around us.
Well, we have come to the end of our hour. I can't believe it's gone by this fast. There's all sorts of things I'd love to talk to you about. As seems like it's getting easier for people to lose weight. That we've got medications that do all sorts of things, and at what point do self-esteem and the way we look at ourselves? Most of people my age, we look back at pictures of us in high school and we go, I really look that good. I guess, self-esteem of a teenager is like we all think we're fat and dumpy, and we now look back and it goes, wow, I had no idea. So how does that all factor in psychologically in what we do in our activities? But that'll be for another day. So our guest this evening has been Dr. Mark Vander Weeg. He is the professor and head of community and behavioral health at the University of Iowa and an expert on behavior modification. We've been talking about behavior modification as it relates to cancer. So thank you so much, Mark, for being our guest. If anyone knows someone that would benefit by watching this program, the good news is that it's going to be available on demand beginning tomorrow at the Above and Beyond Cancer YouTube channel or the Mercy Cancer Center website. I hope you'll join us again next week. Thanks, everyone.